London in the UK. But I think overall people are thinking that the protocol, the national protocol, is working just fine so far.
Okay, Tor Shorter of the Spill, do stay with us on the line. We are also joined now, we had a bit of a technical problem before, by Jonathan Sacerdoti, our European I-24 News European correspondent. Jonathan, good morning to you.
Good morning.
Okay, well, clearly that's the German news that we've had since yesterday. And the understanding also that at Heathrow now, screenings have begun to test for Ebola. Is that the case?
That is the case, and we've also heard that US President Barack Obama will hold a video conference today with the leaders of Britain, France, Germany and Italy to discuss the Ebola epidemic in West Africa. But of course the fear is that whatever we do to combat and contain the spread of the disease might not be enough, because all it takes is one small human error each time for transmission to occur. So far, usually in cases where medical staff have been caring for those suffering from Ebola. But each time that happens, fear grows a little bit within Europe and elsewhere in the world. And there is the fear that then it will make the next leap from healthcare workers to the general population. Yeah. But as you say, in Heathrow Airport Terminal 1, screening started yesterday and the day before with questionnaires and taking of temperatures of passengers coming from those high-risk areas. And that is set to roll out across all of Heathrow's terminals and then at Gatwick Airport, also in London, during the rest of the week at high cost to the United Kingdom of around £9 million.
£9 million to do those screenings. And Thor, I'm sure they're joining us also still from Germany on the line. Are there screenings expected now in Germany's airports?
Please come again.
Are there screenings screenings to test for Ebola expected now also in Germany's airports? Any measures that the authorities in Germany have said that they're going to put in place to try, and prevent any other cases from entering the country?
There are no such teams at the airport yet, although there is a certain protocol that would be followed if a passenger would show certain symptoms on the airplane, like, for instance, fever above 38.5 degrees, vomiting, diarrhea, bleeding. He would be separated from the rest of the passengers, and these passengers would be labeled and put into quarantine. So there is a protocol, but there's no testing on the airports at the moment.
And those have not been demanded by the population or any criticism in terms of that, in terms of the reaction to the death of the UN worker in Germany?
Well, as I pointed out before, there is such sentiment, which the poll that I just quoted shows that people, 85% of the people, do demand tougher border control. The problem also is that we are a federal state, so it is also left to the different states, of 16 states of Germany, how to deal with it. For example, in Munich, they have put up a certain infectious team to deal with this situation, and in the state of Niedersachsen, they are especially taking care of the refugee camps because they are fearing that there could be an outbreak in one of these places. So, yes, people are taking care.
And is there any information in terms of the experimental drug that was used with the Ebola patient in Germany who sadly passed away? Because supposedly an experimental drug that everybody was speaking about was used to try and help him, but he did, he died eventually, sadly. Any information coming out of that?
All I know about this case is that he was already in very critical condition when he arrived to Germany last week, and that doctors were saying that the probability of treating him positively wasn't very high. So I have no information on whether this medicine was used.
And then in that respect, and in that respect, Jonathan Sacerdoti, when it comes to experimental drugs and et cetera, on the on the medicine cutting edge of this, there seem to be reports that something's trying to be developed very, very, very quickly, which sadly has not been the case thus far, when Ebola has been a disease that existed in Africa for many, many, many years. But in the UK, when it comes to public opinion, and I know that people are always very calm and collected, but is there concern? Is the concern rising now with screenings at the airports?
Concern is rising. I mean, I wouldn't say there's panic among the general population yet, But it's certainly the case that people are wondering. I was just discussing with friends yesterday whether or not they felt taking the tube was a good idea, the underground here, whether they felt that it was a possible incubator for coughs and colds and other diseases like Ebola. Of course, these things are at the moment still at the level of a bit of a joke, but people are thinking twice about what kinds of situations they're getting in case there could be this transmission of the disease, which, of course, as we know, is transmitted through bodily fluids, so coughs and sneezes and the like. And even in the cases where we see those medical healthcare workers wearing these protective suits, we've then heard of cases of the disease still managing to be transmitted through presumably human error in the removal of those suits after touching patients. But that seems to get people very worried that this is highly contagious. And we're hearing mixed messages from officials at government level and health officials, which some are saying that this is not highly contagious, that even when you come into contact with the bodily fluids, it's a low chance of transmission. But then we see these news stories of healthcare workers treating people in West Africa, transmitting the disease despite the precautions we see on the news, and people are, of course, conflicted and confused. Ebola has so far killed more than 4,000 people in West Africa, and the first cases outside Africa are being reported both here in Europe and in the US, as we've heard. So far, most of the dead have been in Guinea, Liberia, and Sierra Leone. But we know, as the health secretary here in the United Kingdom have said, it's inevitable that within the coming months we will have, as he put it, a handful of Ebola cases here in the United Kingdom. And hearing things like that is only making people more concerned, even though we know the screening in the airports is starting to roll out, and we know that doctors and frontline medical staff here are being briefed on how to deal with the outbreak that may be coming our way.
No, definitely. And Tor Schroeder from Das Bild in Germany, it's all a matter of isolation and quick isolation when it comes to Ebola, so it seems. And any reports when it comes to people who were close to the UN worker who passed away yesterday of the virus, and have they been put into isolation?
They have not. This clinic, St. Georg Clinic in Leipzig, is one of 7 clinics in Germany that possesses a so-called specialized isolation unit, which costs about 15,000 euros to run every day, which is 75,000 shekels. These places are meant to be very safe also for the people working there, not only because they possess specially filtered air conditioning, those treatment rooms which kind of function like a giant vacuum cleaner, so all the germs are being sucked away, but also because the medical personnel is specially trained that is working there and being monitored, especially at that moment when they are taking off their protective gear, which is the key moment apparently, and the moment when these 2 nurses that have been affected in both Dallas and Madrid did catch the virus. So, no, they are not being monitored, especially, I believe.
Well, that's, I think, a thing that's concerning to everybody, and especially, of course, the medical staff who has to, who is dealing and trying to help the people who have already been diagnosed or contracted the disease. But again, we will be following Ebola and the attempts to isolate, quarantine people and stop its spread all across the Western world, and as well, of course, the victims in Africa. Thank you both for joining me this morning. Tor Schroeder from Germany, Das Bild, and of course, Jonathan Sacerdoti, our European correspondent, who will be staying with us for the next item.